Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. So I get asked the question this week, Dr. Hulsebus, how do you know where to adjust me? You always say, oh, I found it. Oh, there it is. Oh, I know which one to get now. The question that was asked to me is, how do you know which one? That's a fun question, and I'm going to answer that question. How does a chiropractor know which vertebrae to adjust? How we do it in my office. I can't speak for other chiropractors because there's lots of different techniques, lots of different styles to adjust. But I'm going to answer the question how, in my office, when you come in, we know how to adjust you. And it's a multi-step process. It's not just come on in, lay down, boom, there it is. The first step of this is your history. We take a history of you, we get to learn a little bit about you. We know that between two vertebrae, a nerve comes out, and that nerve goes to a body part. Based on your medical history, if you've had health concerns or issues, we start to suspect that maybe the nerves coming from that two vertebrae ago, that one body part might be the issue, and this is why maybe you're not feeling the way you're supposed to be feeling or the way you have been feeling. So that's always step one, getting your medical history. That gives us a clue to what's going on. You see, when two bones in your spine are misaligned, they call that a vertebral subluxation. And when a vertebral subluxation happens, there's a stress that happens at that joint and it travels down to that nerve. So if you've had a history of stomach problems, we're going to suspect you might have a problem at T5, your fifth thoracic, because that's where the nerve that goes to your stomach comes from. But we don't go by that alone. No, we will do x-rays of you, take full spine images of your spine to see what's going on with your spine. Because for every yin, there's a yang, meaning that your eyes will always stay level. So if you have one spot in your lower back shifting you off to one direction, you'll have your neck move the opposite direction to balance you out. And they call that the righting reflex. So as chiropractors, we're always looking for both spots because we don't really know which one came first. There might be one talking more than the other one, but we don't know which one came first until we get you under care. The second thing we do is we actually do a chiropractic exam. When you lay on the table, especially your first couple of visits, we're going to ask you to lift one leg, not the other leg, then lift this leg, then that leg, then lift them both. We're going to take your feet, we're going to measure them, we're going to bend your hips. We're going to have you turn your head this way, have you turn your head the other direction. We're going to see how your spine's moving and how it behaves. So we don't use your history alone, we don't use your x-ray alone, and we don't use your exam alone. We use the combination of all of them. The other tool I have is my table. When you come in, you lay face down, the table brings you down nice and slowly. I know your nose is right in the middle of the table, right? Because that's where it fits. But if the whole lower half of your torso is shifted to the left, then I know there's something going on in your spine because your head's over here, nice and centered, but your torso is shifted to the left. There must be something going on. So when I look at your posture, I look at your exam findings, I look at your x-rays, and I look at your history. Now it's getting real obvious maybe what's going on. And the last thing you'll do is you'll know that we'll feel up and down your back. There we're trying to feel how your muscle fibers feel. Is there an area where you're resisting when I give you a little push? Like as soon as I touch it, your spine locks up because it's trying to protect itself. It's trying to protect itself from further injury. But as a chiropractor, we know that this is an area of stress. This is an area that's probably a subluxation hanging out. So we use the combined efforts of all the above. Your history, your x-ray findings, your exam findings, how you lay on the table, and lastly, what we do when we feel up and down your back, and we put the puzzle together, and that's how we come up with things. Now, a lot of times you might see that we check this and then go back and check it again. You see the pelvis bones, the lower back likes to rotate the most to counterbalance what else is going on. So we don't always necessarily get over aggressive with them in the beginning of your visit more than we do at the end of your visit. We'll take your legs and we'll measure them. And we're going to see if you have a long leg or a short leg. If you have a long leg or a short leg, that suspects something's going on. Then typically we have you lift a leg but don't bend the knee and lift the other leg and don't bend the knee. This helps us determine whether it's your tailbone or your hip. If it's your tailbone, or otherwise known as your sacrum, it'll actually rotate and get in the way of your leg coming up. And you might tell me, it doesn't hurt to lift my leg, but it doesn't feel like I can lift that leg as high as I can the other one. And that's a huge clue to me to what's going on. That's a huge clue to me that your tailbone's out of alignment. Now, if your feet, one leg is longer, one leg shorter, and you lift both legs and it feels the same, now I'm thinking that your actual hip is going on. A lot of people call this joint the SI joint. I have a problem with my SI joint. A lot of people also come in and say, I have a problem with my sciatica joint. There's no sciatica joint, but I always know you're talking about the SI joint. And this is the pain you're going to feel about 2 inches from midline on the back side, usually right above or below your belt line. You're going to say, I have a nagging pain right here. And that's us trying to get to the bottom of this one. So we bend both knees. If you bend both knees together at the same time and your long leg gets shorter or your short leg is longer, then we're pretty sure that you have hip involvement. But if your long leg or your short leg even out, then we're back to thinking the tailbone, but you passed the other tailbone test, sacrum test. So now we're going to do some adjusting and clearing some things out because we're getting false positives. So we'll adjust your thoracic spine where your ribs are, your lower back, your lumbar spine. Then we'll take a look at your neck, your cervical spine. Then I usually have you take a few steps in the room and lay back down. We have you take a few steps around the room to resettle everything, get things back to where they were. Let gravity do a little bit of work on you to see really what's going on. So we'll have you walk around a little bit, get you recentered, get you back in the center of gravity, and then we'll do another assessment of you. We'll probably bend your legs again, feel your legs again, pinch here, have you lift this leg and this leg. Then usually we get to lower what's going on. Now you might hear the table pop 3 times, or you might not. It might be so far out that we have to get a more aggressive adjusting style. But if we do the table 3 times, you hear pop, pop, I typically tend to believe that that means that really wasn't the issue. It was just compensating for a different issue. We were able to clear it out really fast and really easy. So that's a lot of how we know where to adjust you. It is the tools that chiropractors have. Now, the history, that's pretty easy. Every chiropractor gets a history. Every chiropractor learns the chart where the nerves go. Your x-rays, we go through extensive x-ray training in order to become chiropractors to evaluate your spine for misalignments. So pretty much every chiropractor is pretty good at doing that. When it comes to the exam findings, when it comes to the palpation thing, that's where the art of chiropractic kicks in. We always say chiropractic is an art, science, and philosophy. This is where the art comes in. How good is my finger skills? How many patients have I seen in order to learn the trends of what's going on? How many clinical experiences have I gone through to see, oh, you know what, when I see this, don't just jump, there's going to be that. I've seen this many times present wrongly, and I have to do this and this first. And that's where our clinic has a head and toes above most clinics, because we've been open since 1949. Now, I haven't been here since 1949. I'm not that old. But I get lessons taught to me from my dad, who was taught by my grandfather. And so we've heard stories, we've heard cases. My first couple of years, my father was in the room with me. He's, now, you see this? Don't just assume it's that. And they might have taught you that, but don't assume it's that. Let's try this and this, and we get great results on patients. We have quite a few patients where it says, ignore what you learned. This is actually what works on this patient. So we had the benefit of that. So chiropractors with lots of experience tend to see this. So if you go to a chiropractor that's maybe young, but got a lot of patients in there, but seeing a lot of people, then we know this chiropractor probably has a lot of experience because they're seeing lots of folks. Older chiropractors, again, you might think, oh, they're getting too old, they don't know everything. Well, they might not be as up to date. When I graduated, there was no motion MRI machines, but now there are. So did I learn a lot of motion MRI machines in school? Not really, but I've learned a lot about them since. So you might think he's been out of school for 20 years. He's probably forgotten a lot. The advantage there is that I have a lot of experience. So you have to see which chiropractor can find your issues and what's going on. Us in our office, we have doctors that have been here for less than a year, doctors that have been here, like myself, for 23 years. And we work as a team. We all look at the x-rays together, the exam findings together. And when we have a patient that's we're struggling with or not getting the results as fast as we want to, I should say, we bring the other chiropractors and have them look together. So sometimes going to a chiropractic clinic where there's more than one chiropractor could be an advantage. But even here at Rockford, we get together once a month, all the local chiropractors, and we do talk about, hey, I got a patient presenting with this and this. Has anybody had any experience with that? And we do rely on each other a lot more than you think we would. A lot of people think, oh, you talked to that chiropractor? I thought he was your competition. We're not competitive against each other because only 10% of the population see a chiropractor, so we don't have to compete with each other. So that's a little bit about what we look for when you come in the clinic. So when the chiropractor says, oh, I think I found your problem. Oh, I know it's this one. How do we know this one, that one? Now, if there's a chiropractor out there that's not being specific, they use tools or apparatuses that they grab, they yank on you and they pull and they crank, and they're not very taking the time to be that exact, they don't get the results. And there's also a question of patient safety. So I would hesitate to ever look at one of those chiropractors. I won't go to one myself, but that's up to you. I would try to find a chiropractor that's very specific in what they're doing and try to avoid the ones that aren't. That's what we do. That's what we look at. That's how we find things. So maybe I made everybody a junior chiropractor by listening today. Remember, if you have a question about what chiropractors do, if chiropractic care can help you, or just anything about chiropractic, there's only one qualified profession that's able to answer these questions, and that's a chiropractor. So don't ask your physical therapist, your strength coach, your massage therapist, your orthopedic doctor, your medical doctor, your family doctor, because they just don't study chiropractic. They don't really know what we do. I work with the hockey team. I'm working with these doctors and these healthcare professionals all the time. And I will tell you, before they met me, they had no idea what I do. So asking them is not always a great idea. But you can ask me. Leave a comment or a message wherever you're listening or hearing this, and go ahead and leave the question there, and maybe next week you'll be the question of the week. I want to thank my patient for giving me this question this week, and hopefully next week we'll have another fun one. Thanks, everybody.